Experts in the field of diabetes want governments around the world to make diabetes education and awareness more accessible to those living with this disease. According to the International Diabetes Federation, there are currently more than 500 million people living with diabetes worldwide. That's 1 in 10 adults. Almost half of them are undiagnosed. On Health Matters today, we're doing our bit to bring home the reality of diabetes. The World Health Organization defines diabetes as a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar as we know it.
Diabetes, in simple terms, is once you've eaten a meal, the meal gets broken down into glucose and the glucose goes into the blood. And in either form of diabetes, what happens is the glucose cannot leave the bloodstream and go to the cells where they need to give the energy which is required. It remains elevated in the blood. And that's because insulin, which is a hormone or messenger, which we all produced, is very important in helping to unlock the cells and allow the sugar to move out of the bloodstream and into the cells. So this is a problem with either not producing enough insulin, in that case is mainly with type 2 or type 1 diabetes, or the insulin is not working effectively as seen in type 2 diabetes.
Diabetes can severely affect your quality of life. If it isn't properly controlled, the level of sugar in your blood goes up and you could end up with major damage to your eyes, heart, feet, nerves and kidneys. It's therefore critical that you know the signs and symptoms of both type 2 and type 1 diabetes.
The symptoms and signs which one is to look out for is frequent urination, feeling thirsty more than usual, having a dry mouth, dizziness and fatigue. We see people may have wounds which take longer to heal, so delayed wound healing. Various forms of infections which can be present, from skin infections such as boils to fungal infections of the skin. But it's important to note in type 2 diabetes, people may not necessarily present with symptoms because those symptoms only arise when those blood sugar levels are very high.
The number of cases of both types of diabetes have been steadily increasing over the past few decades. That's despite widespread education and awareness. During the height of the COVID pandemic, we also learned that people living with diabetes were also more likely to be more seriously affected. But it seems that too was not enough to get people to change their habits.
For type 1 diabetes, we haven't identified any direct cause in the sense anything someone can do to prevent themselves from getting type 1 diabetes. For type 2 diabetes, we often see that risk factors would be being overweight or obese, with body mass index of more than 30, having a family history of type 2 diabetes. In terms of diet, it's having a diet which is very high in refined carbohydrates. So those are foods which are very sugary, junk food. Smoking, it's also a risk factor, and it's an important risk factor to address in terms of diabetes management.
It's encouraging that research into diabetes and how to treat it is ongoing, but we shouldn't depend on new medication or any other treatment. What we should be doing is taking steps to prevent it in the first place.
One way we can prevent is by people undergoing routine screening to also see where they are sitting. In terms of overall implementation, it's important to look at our lifestyles, to start watching in terms of what we eat and the quantity of what we eat, to start exercising regularly. Overall, just living a healthy lifestyle, knowing that if you are at risk, that you can make those changes.
The bottom line is, living a healthy lifestyle can reduce your chances of becoming diabetic or worse still, dying from it. For people living with diabetes, access to affordable treatment, including insulin, is critical to their survival. And that is where governments need to play their part. If they don't get their act together, the International Diabetes Federation warns that the number of diabetes cases is expected to rise to 643 million by the year 2030 and 783 million by 2045. And with that will come millions of unnecessary deaths.